Yeah, just a quick review of the DYUEOK knee brace. Not quite sure how to say that. But anyway, so this brace is made specifically for patients that are having some type of knee pain or some type of problem with their knee. And the idea here is that you put your knee in the brace, and it was kind of supports the joint, kind of supports the surrounding soft tissues around the knee, restricts your knee motion a little bit, and that way your knee has a chance to rest, recover, and won't get so overstressed as you do things. So a few points about this particular brace. It is a highly breathable fabric. So it's got all the holes there, which is really important because you wear this all the time, especially if you're really active, you start to sweat, especially in the summer months, you wear this a lot, you're going to sweat a certain amount. And then after a while, the brace starts to pick up some of that sweat, and then it stinks, and you got to worry about cleaning it and washing it and that kind of stuff. It's always best to start out with a highly breathable fabric. The other thing I like about this one, it's got this patellar ring about it. It's actually got a silicone patellar ring around there. Patella is your kneecap. So if you've had trouble with your kneecap, like being dislocated or, being pulled to one side or any tracking problems, this will really take an extra step to kind of keep your kneecap where it's at. Give that a little extra stability. So anyway, other things you can do for your knee besides a brace. As an example, I'm just getting this from this book, Bulletproof Your Knee. If you have any kind of knee problems, make sure you do at least one exercise to strengthen your quadriceps muscle. The quadriceps muscle is a big muscle, actually made up of four smaller muscles. That's why it's called quadriceps. But anyway, big muscle here. There's your kneecap there, kind of give you some orientation. Sits on the top of your thigh. It's the big stabilizer of your knee joint. So if you don't have stability of your knee joint, then any problem you have is going to be aggravated, and it could cause you other problems as well. So what they're finding, matter of fact, this whole chapter is just dedicated to various knee problems that people have. And then when researchers go and investigate these people with these various knee problems, they find they also have a problem with their quads. Turns out just about any problem you have with your knee, I can probably show you a study that you have problems with your quadriceps muscle. So it's kind of a selective problem. And none of the other muscles around the knee really have this selective problem. The problem being that it's either weaker than normal when they strength test it compared to the other muscles around the knee, or if they look at it on a CT scan and look at cross-sectional area, it's actually smaller than it's supposed to be. So lots of problems you could have. For instance, knee swelling in the quadriceps. Here's interesting. Another study demonstrated that even if you have as little as 20 milliliters of fluid in your knee, which is just over a tablespoon, it's enough to decrease the strength of your quadriceps muscle. So if you have any kind of chronic swelling in your knee, probably have decreased strength of your quadriceps. Knee injuries in the quadriceps. So if you had various things, like if you ever had a surgical opening of the joint, researchers find the quadriceps is weak, fractured your tibia, lower leg bone, that kind of stuff. Ligament problems, and that's a big one. Anterior cruciate ligament, also known as your ACL. Look at researchers show that when people have completely ruptured their ACL, get around to strength testing the quadricep muscle, its strength is decreased by 25 to 30%. Now that's compromising an awful lot of knee stability, and then you start having secondary problems. Posterior cruciate ligament, PCL, same thing. Medial collateral ligament, that's on the medial, that's on the inside. The problem, knee pain in the quadriceps. If you had like chronic pain in your knee, and researchers would strength test people that have that problem, they find decreased quadricep strength. Knee arthritis. Now, here's an interesting one. So a lot of research actually out there, if you type in knee arthritis and quadriceps, you find that most studies, I think practically all of them, are showing that if you have knee arthritis, you have decreased quad strength. Likewise, interestingly enough, there are actually randomized controlled trials out there showing that if you go ahead and you take people with knee arthritis and you strengthen just their quadriceps muscle, their knee pain starts to go away. And likewise, the people with the stronger quadriceps actually have less progression of their knee arthritis. So you can actually interrupt kind of this pathological knee arthritis process by strengthening your quads. Patellofemoral pain syndrome, and the list just goes on and on. Moral of the story, if you have any kind of problem with your knee, make sure you have a strong quad. Fine-tune control over your knee. Here they're talking about the hip muscles. So for instance, sometimes you have knee pain, but the problem really isn't down at the knee. Maybe it's because of a hip, some problem up at the hip. Classic case is iliotibial syndrome. If you take a group of people with iliotibial syndrome, you strength test their hip muscles, you find they have unusually weak hip abductors. And likewise, here again, randomized controlled trial showing that if you strengthen the hip abductor muscles, iliotibial syndrome goes away. So always something to cover. Optimized knee flexibility. We all know we need to have a flexibility. Oh, interesting. We all know we need to have a very flexible knee. Your knee bends and straightens. A lot of people don't know is that your knee actually rotates So about the last 15 degrees of you straightening your leg, it actually rotates laterally or out to the side. And here's a little test to see if you have the accessory motion, which you need to have a fully functioning knee. Anyway, other things you can do, there's about one more thing I can think of here. Increased dynamic knee stability. Here they're talking about proprioception. So proprioception is your position sense. So let's say right now I turn out the lights and you're in pitch black dark room. You would probably be able to tell me whether your knee is bent or straight. And that's because of the little joint receptors and the muscle receptors constantly giving your brain feedback as to where your knee is in space. So you always know where your knee is, so you know how to move and where to move it. What they're finding in people with various knee problems is that they have decreased proprioception. It's not like it's not there, it's just that it's really decreased and it's not really what it should be. And there's actually exercises you can do for that. But anyway, things you can do. But yeah, nothing's as quick as putting on a brace. A lot of people put on a brace, they get kind of instant pain relief. So it's a good brace. Check it out.